We're going to explain what happens if your blood is too thin. 1. Blood that's too thin, also called having low blood viscosity, means it doesn't clot properly. This is primarily due to a deficiency in clotting factors or platelets. 2. The most immediate and serious consequence is excessive bleeding. Even minor cuts or injuries can lead to prolonged bleeding that's difficult to stop, potentially resulting in significant blood loss and even life-threatening conditions like hemorrhagic shock. 3. Internal bleeding is a particularly dangerous risk. This could occur anywhere in the body, including the brain, leading to stroke, the digestive tract, causing internal hemorrhaging, or joints, causing pain and swelling. 4. Bruising easily is another common sign. Because your blood doesn't clot effectively, even minor trauma can cause large, widespread bruises. 5. Prolonged menstrual bleeding in women is another indicator. Heavier than normal periods or periods that last much longer than usual are possible if your blood is too thin. 6. Anemia can result from the chronic blood loss associated with having blood that's too thin. Anemia causes fatigue, weakness, shortness of breath, and pale skin. 7. The underlying cause of your thin blood needs to be identified and treated by a medical professional. The treatment depends on the reason for the thin blood, and this is very important. Common causes might include liver disease, certain medications like blood thinners, vitamin K deficiency, or inherited bleeding disorders like hemophilia. 8. Diagnosing thin blood involves blood tests that measure your platelet count, clotting time, and the levels of various clotting factors. 9. If your blood is determined to be too thin, your doctor may recommend medication to help your blood clot more effectively. This might include vitamin K supplements if a deficiency is identified, or medications to help increase platelet count or the activity of clotting factors. 10. In some cases, a blood transfusion may be necessary if you've experienced significant blood loss. Remember, self-treating is never a good idea. Always consult your doctor if you suspect you have thin blood. They can properly diagnose the issue and provide the appropriate treatment plan to address the underlying cause and mitigate